Welcome. Today, we're discussing the significance of Kegel exercises during pregnancy. These exercises help strengthen the pelvic floor muscles, which can alleviate common pregnancy discomforts and prepare the body for childbirth. Stay tuned as we delve into the benefits and proper techniques. What is Kegel exercise? Kegel exercise is a form of pelvic floor exercise that involves squeezing and relaxing muscles in the pelvic and genital areas. These muscles support the pelvic organs, including the bladder, uterus, small intestine, and rectum. Kegel exercises directly benefit labor and delivery. Tips for doing Kegel exercise. To get the most out of doing your Kegels, keep these tips in mind. Don't do Kegels while peeing, as this may prevent your bladder from fully emptying. Don't strain or hold your breath, and keep your abdominal, buttock, and thigh muscles relaxed. Don't overdo it. After starting to do these exercises, it can be normal to feel some soreness around the pelvic area. But if you feel pain, stop it. What do Kegel exercises actually do? Kegel exercises help keep your pelvic floor muscles fit, much like you may strengthen other muscles in your body by lifting weights. Doing Kegels is a way to keep your pelvic floor muscles strong and prevent your pelvic muscles from getting weak. Who needs to do Kegels? Certain health conditions or life events can make your pelvic floor muscles weak. Some of these conditions and events include pregnancy, childbirth including a C-section, having obesity, surgery in your pelvic area, aging. The muscles of your pelvic floor naturally weaken with age, excessive straining while constipation or chronic coughing, exercises especially jumping, running and lifting heavy weights. However, Kegel exercises aren't for everyone. Doing too many Kegels or doing Kegels when you don't need to can cause your muscles to become too tense or tight. Kegel exercises in pregnancy. People who are pregnant may find that delivery is easier if they do Kegels during pregnancy. This is because it may give you greater control over your pelvic muscles during labor and delivery. It can also help with bladder control, strengthening the muscles that support the weight of the fetus, urinary incontinence or leaking pee, pushing during vaginal delivery, perineal healing after delivery. How do you know if you are doing Kegels correctly? Doing Kegels shouldn't hurt. If your stomach, lower back or head hurt after doing Kegels, you're probably holding your breath or clenching the wrong muscles. If you're having trouble finding your pelvic floor muscles or experience pain and discomfort, you may be doing Kegels wrong. If you're doing Kegels correctly, you should notice your symptoms improve gradually over several weeks. When to do Kegels exercises. If you are pregnant, you may want to start in the second trimester, which starts at around 14 weeks pregnant. This is when many moms-to-be experience a much-needed energy boost. After your baby is born, you may be able to start doing Kegels within a few days of an uncomplicated vaginal birth. Thank you for tuning in to explore the significance of Kegel exercises during pregnancy with us. Don't forget to give it a thumbs up and hit the subscribe button below to join our community.